Hey everyone, welcome back to the channel. Today, we're diving into the complex and emotional journey that one patient, Patrick, is going through as he navigates advanced prostate cancer. This story highlights the importance of palliative care, end-of-life planning, and the difficult decisions that come with managing terminal illness. It's a reminder for all of us about the delicate balance between treatment and quality of life. Grab a coffee, get comfy, and let's dive deep into Patrick's medical journey. Patrick's journey started with a diagnosis of metastatic prostate cancer. For those unfamiliar, metastatic cancer is when the disease spreads from the original site to other parts of the body. In Patrick's case, it spread to his bones, which is quite common for advanced prostate cancer. His prostate-specific antigen, PSA, level was 369 nanogram per milliliter, a significant marker that shows cancer progression. To give you an idea of how serious this is, a normal PSA level for men is usually under 4 nanogram per milliliter, and anything above that could be concerning. As it climbs, it's an indication that the cancer may be growing or spreading. Patrick's IPSS score, International Prostate Symptom Score, was 7+2, suggesting moderate to severe urinary symptoms, something many men with prostate cancer may experience due to prostate enlargement or other treatments. But what makes Patrick's case particularly concerning is the advanced stage of his cancer. He is classified as T34, N1, M1B, which means the cancer has spread to his bones, pelvis, and beyond. For those keeping track, that's a tough diagnosis to face, and Patrick's medical team is working hard to manage it. Now, let's talk about Patrick's treatment plan. Since his diagnosis, he has been on a variety of therapies to try and control the cancer's progression and alleviate his symptoms. He started with androgen deprivation therapy, ADT, using LHRH agonists, which help lower the body's testosterone levels. Testosterone can fuel the growth of prostate cancer, so controlling it is critical. However, Patrick had to switch from Zoladex to Prostate after developing leg swelling, which can be a side effect of these medications. In October 2023, he started enzalutamide, a medication that blocks androgen receptors and further inhibits testosterone's role in fueling cancer growth. But even with these treatments, Patrick's cancer continued to progress. By December 2023, the enzalutamide dose had to be halved due to possible toxicity, which might have been related to an infection rather than the medication itself. Fast forward to April 2024, Patrick's PSA was rising again, which led to his enzalutamide dose being increased to its full dose, and additional tests and scans were ordered to understand the situation better. Then came May 2024, and after palliative radiotherapy, Patrick's skeletal metastatic disease showed improvement in left pelvic bones. But despite this, he still faced challenges with his mobility and pain. For anyone with advanced cancer, the goal of palliative treatments like these is not to cure, but to manage symptoms and improve quality of life. But, as you'll see, that's not always straightforward. As the months went on, Patrick's health began to decline. By November 2024, his cancer showed signs of biochemical and radiological progression, meaning it was not only visible on scans, but also affecting his body's chemistry. The oncology team considered moving to docetaxel chemotherapy, a potent treatment often used for advanced prostate cancer. But Patrick's declining performance status raised concerns about whether he would tolerate it. A couple of weeks later, Patrick developed worsening pain and numbness in his jaw, which raised alarms about possible nerve involvement, especially in the trigeminal nerve, something that's not uncommon when cancer spreads to the head and neck. Unfortunately, by December 2024, MRI scans confirmed a metastasis at C4, cervical spine, which added further complexity to his treatment options. Despite his deteriorating condition, Patrick's medical team still recommended palliative radiotherapy to his cervical spine and retreatment to his pelvis. But by January 2025, Patrick made the difficult decision to decline cervical spine radiotherapy due to his symptoms and fears about further nerve damage. Instead, Patrick was set to start docetaxel chemotherapy, though his ongoing decline had made the future uncertain. Fast forward to the most recent clinic review, where Patrick came in with his wife for an update on his condition. Patrick had been feeling progressively worse, including increased confusion and poor appetite, and he'd lost around 10 kilograms since July 2024. His mobility had significantly worsened, and he had transitioned from using sticks to a Zimmer frame to help him walk. This is a significant change in his functional ability. His medical team has been closely monitoring his pain, which is largely concentrated in his left hip. Despite recent palliative treatments, the pain hasn't improved much. On top of this, Patrick has developed incontinence, which is another challenge in managing his quality of life. Perhaps one of the most concerning symptoms Patrick presented with was numbness in his left jaw, which could indicate worsening nerve involvement. His doctors reviewed recent MRI scans, which didn't show any new focal lesions in his head or neck, but they decided to hold off on further imaging for now due to the lack of new, clear abnormalities. So what's next? Well, Patrick's doctors are deeply concerned. His PSA has increased to 63.3 nanograms per milliliter, up from 18.4 nanograms per milliliter just a few months ago. This is another indication that his cancer is not only progressing, but might be doing so at a much faster rate than they anticipated. Given his overall condition, Patrick may not be a good candidate for further chemotherapy, and unfortunately, there aren't many other treatment options left. This is a heartbreaking realization for both Patrick and his medical team, who are now focused on making him as comfortable as possible during his remaining time. They've recommended that he be referred to the community palliative care team to help manage his symptoms and guide him through the difficult process of advanced care planning. Advanced care planning is a crucial part of managing a terminal illness like Patrick's. It's about giving patients and their families the chance to discuss and decide on the kind of care they want as they approach the end of life. For Patrick, it's now time to think about where he wants to spend his final days, whether at home or in a hospice. His doctors have suggested that his GP discuss these plans with him, ensuring that his wishes are respected, no matter what comes next. Patrick's journey shows us just how unpredictable cancer can be. Sometimes, despite our best efforts, it progresses in ways we can't control. But with the right care, the right support, and a focus on quality of life, patients can still find peace in their final days. As we wrap up today's video, I want to leave you with a few key takeaways. Advanced cancer treatment is often about symptom management, not just curing the disease. Palliative care is essential in providing comfort and supporting families during tough times. Advanced care planning can help patients make informed decisions about their future care, ensuring their wishes are respected. Thank you for watching today's video. If you found this story insightful or know someone who might benefit from hearing it, make sure to like, share, and subscribe for more content like this. And as always, let me know your thoughts in the comments below. Let's keep the conversation going. And remember, every patient's journey is unique, and the healthcare community is here to support them every step of the way. Stay safe, take care of yourselves and your loved ones, and I'll see you in the next one.